All right, you guys, we're at Americana Community Center this morning, and they're having a COVID vaccine clinic. All of the major players are here that you usually see only on the press conferences every week. Sarah Beth Hartledge is here, who is the doctor in charge of she's the assistant actually to assistant director. Sorry guys, I'm trying to undress and get set up at the same time. She's the assistant director, medical director for the health department. She has a wealth of knowledge. She runs the dashboard. She keeps everybody posted about the statistics every single week. We have a press conference. She knows exactly what the numbers are. She's amazing. That's Dr. Hartledge in the light blue mask with the floral top on, standing in the corner there. Delano Manson is here. She's getting her picture taken with the mayor. She's been given a recognition today. Delano is the head of the Kentucky Nurses Association, an absolutely amazing woman. Kathy Turner, with her back to us, wearing all black, is how you doing? Wearing all black is taking pictures of all of the folks who are here and all of their recognition, which is awesome. So it's I'm sorry that I missed the press conference. You guys got tied up on some other things, but certainly am glad to be able to be here for just a minute and get some words of wisdom from the folks who bring you all the information that you could possibly ever need to stay alive during COVID, which is pretty amazing when you stop to think about it. These people have dedicated their lives for the last nearly 2 years to keeping up with the statistics, keeping up with all of the different types of variants that have blown up, informing the public, fighting to get every bit of technology and every bit of vaccination knowledge. Whenever you guys are ready, every bit of knowledge out there that they can possibly give, these guys have gotten it. So I'm going to plug in real quick, and would really appreciate a thumbs up if you can hear me. I'm going to plug my and hope that we can get sound in the midst. Give me some thumbs up or give me some comments and let me know. If you don't mind, let me know if you can hear me. I see a heart. That's a good sign. Put in a comment so I can actually see that you guys are hearing what I'm saying, okay? That'd be terrific. Appreciate it. Thanks, Sam. Good, because I just plugged my mic in. And sometimes if you plug in after you've started a live stream, it kind of screws up and doesn't pick up the sound. So Kathy Turner is going to get me a couple of conversations with a couple of folks here. But as I said, they just had a huge press conference. They gave out a tremendous number of awards, and everybody's just kind of fellowshipping a little bit after that, which is phenomenal, and everybody's getting a chance to just reflect on all the hard work that they've done. We're at the Americana Community Center, by the way, for anybody who doesn't know. Thank you, guys. Thank you, Ed. Thanks, Catherine. Thanks, Sam. I don't know how many of you caught my live stream yesterday with the political science professor from the University of Louisville, but it was quite a fascinating conversation about how the Russian invasion of Ukraine is impacting us in the United States. And Dr. Chuck Ziegler was phenomenal. It was 1 hour. If you haven't had a chance, I would suggest you go back and see it. I think it's a great hour of viewing, a lot of good conversations, challenging questions that were posed by viewers. Yeah, I think it's worth it. So go back and look at that live stream from yesterday and see what you think. In the meantime, we're getting another photo op set up. Everybody's getting their pictures taken. Everybody's still wearing their masks too, by the way. Regardless of what you've heard about the CDC changing its recommendations, Louisville is still in the red zone. We still have a significant caseload, and indoor mask wearing is still very much recommended. Just FYI. I'm going to address that with Dr. Hartledge in just a minute. Try to get around so I don't wipe out my WLKY friend Scott. How you doing? So mayor's waving at us. It's so funny how the 502 live streamers have become a force in media in this town, with our constant presence everywhere. A group of really dedicated live streamers that started in the protests together and expanded into a community kind of service news gathering organization. Really appreciate all the efforts of the folks involved. And the fact that we've been recognized by a lot of the agencies that send out press releases, and never would have thought in a million years to recognize the live streamers now do that. So it makes us feel good. It makes us feel like our work has been validated and appreciated. And I appreciate very much the opportunity to cover things that are important to the community.
She doesn't want to. I get it. What about
I'll just hop on with whoever 32. I'll hop on with whoever you're going to talk to. Will you tell me just off camera, tell me a little bit about the awards that were handed out. I'm sure they're for doing all the work they've been doing, right?
From the beginning, how a lot of people have been here from the beginning, or a lot of 15 or over times, or got an award just for their service within the community and the immigrant community, and being such an important part of getting those within this community vaccinated and access to vaccinations within their language and help them feel safe.
Fabulous.
Yeah.
Fabulous. I'm so sorry I missed it, but man, I'm just so glad that you could fill us in. Thank you.
Yeah, I know you're vaccinated and boosted. Do you mind if I talk to you?
No, not at all.
I'll put a microphone on you. Can you
Go
run
ahead.
it up your shirt? Yeah.
Watching you guys every evening. So, is this going to come on Sunday?
Yes, it'll be on tonight at 11.
Okay.
Yes. And if you want to put this in your pocket or clip it, whatever you want.
And I'm just going to hold my mic out. You don't have to worry about it.
Okay. Are you with WX?
I am a live streamer. My name is Tara Bassett, so I'm an independent media. I just like to piggyback with them sometimes.
Love Tara.
Collaboration is always a good thing.
It's awesome. It's an awesome thing.
Alright.
Let me drop this down
Yeah,
somewhere.
Grab your trash can somewhere.
Some paper that I can cut here.
Feel like a teacher.
Yeah.
Alright, so you'll just look right at me the whole time. Will you start off, will you say and spell your first and last name for me?
Alright. My name is Kevin Wisenga. That's Uyisенga.
And then what is your title or your position?
I am the executive director for C4 Ministries, which is an organization that works with African immigrants and refugees. We try to help them out with integration in our city.
Absolutely. Talk to me a little bit about your involvement in helping people within the African community, immigrant communities, are able to get access to vaccines. Talk to me a little bit about what you all have done in order to help this community.
Yeah, so when the pandemic hit, obviously we were all trying to figure out what's going on. And so I could really just feel the pain or the confusion from our population, our refugees and immigrants who didn't understand English. It was difficult for the Americans themselves. And so, and then I started with making some videos. We did translation in multiple languages. Just made sure that these folks are able to keep up with the information that's going on. And so we pointed them to the right direction, SARS to get vaccinated. And so we did all that work, transportation when it needed. And so they really counted on on us to really be the source of information. And so we started a small YouTube channel so that they can be listening and keeping up called C4 TV. And so we give out the information on a weekly basis just to educate our people.
Absolutely. And this is the 20th vaccination event here. How important, not only for the African community, but for the other communities, Hispanic, other people who may have some kind of language barrier or communication barrier when it comes to getting vaccinated safely. How important are events like these and having something within this community that is so largely immigrant populated? Why are these events so important?
These events are important because we do things together. First of all, we identify folks that we can trust and trust the leadership. And so when we are here, when we identify this space as one of the sites that we want to be leading our people to, there's a lot of refugees and immigrants in this area. So it's easy for them to get here. And so, but also we really just wanted to find ways to be together, make sure that if we are getting vaccinated, they're able to see those of us who are leading the communities getting vaccinated. And so it was good to get all this done in one place instead of one going the ways. So we just wanted to make sure that we can do all this together and lean on each other for support and for confidence. And I remember one of these days I said, "You're getting vaccinated, I'm getting vaccinated." And so if Kevin is getting vaccinated, maybe that's probably the right thing to do. And so we just wanted to be sure to ensure that trust and the confidence in our people as we led the community throughout this pandemic, horrible pandemic season.
Kevin, can you give us an idea of any of the numbers in the countries from which a lot of these folks come? Vaccination numbers. I'm interested in knowing what the success rate is of those who are still living in the native countries that a lot of our immigrants have come from. Do you have any numbers for us?
Yeah, not an exact number, but we do have a lot of refugees and immigrants in our city. And so our population, the group that we serve has been growing and growing quite often. And so we do have I'd say over 50% of the refugee population, our organization is really working with them, and so the ones that we work with mainly are from East Africa, and so in our city, I'd say our organization only is just saving almost over 7,000 population in our city, and so we have a lot of work to do. And but good thing is we are not doing it alone. We are doing it with the local citizen and just leaning on each other, and that's what I enjoy about our city and what we're trying to do. We want people to jump in and show us the way, and so this is something that we've learned, particularly throughout this pandemic, because it brought us together.
Thank you, Kevin. Appreciate you.
My last question for you, something that even I take for granted is simple communication when it comes to information on vaccines.
I'm going to hop over here. Amazing. I'm going to hop over here to the genius. The genius, Dr. Hartledge.
Yes.
They gave that to you and I didn't even get to take a picture. You can hop in there too if you want to. You look fabulous, by the way. Dr. Hartledge, I was just talking to Kevin about the fact that you guys have done a great job with giving vaccination opportunities to the immigrant population here, and I was asking him if he had any comparison, maybe you do, to the numbers of the native lands. You know, we've talked about if we don't get the world vaccinated, we're not going to be able to keep this from being a pandemic for years.
You know, that's a really interesting question, and I don't know that answer, but we absolutely should look at it.
Yeah.
You know, as you mentioned, like the global vaccine equity is something that we absolutely need if we're going to end the pandemic at any point.
Yeah.
You know, we've given billions of doses of vaccines across the world, but there are still billions of people who haven't had that opportunity yet. So I do hope that we are able to see further distribution. Southeast Asia and Africa, of course, are some of the hot spots where we're not seeing lots of vaccine distribution. And as a consequence, those are kind of where the variants are coming from.
Yeah,
so.
absolutely. So a little bit about the CDC guidelines loosening today across the country, talking about a lot of places don't need indoor masking. I noticed everyone here today is still wearing a mask.
Yes.
And we are still in the red zone, apparently, in Louisville. Talk to us a bit
Absolutely.
about that.
So the CDC is shifting from the way that they categorize the high, medium, and low levels of COVID activity in a county or in an area. And they are shifting away from a purely case count basis to really placing an emphasis on hospitalizations and resource allocation. So essentially what they're saying is that COVID is kind of here to stay, and that zero COVID is not really a realistic thing at this point, certainly in the United States. And so if it's going to keep transmitting, that is what it is. But we want to try to focus on preventing severe illness, preventing deaths, and preventing our hospital system from getting overrun. So, we saw with Delta a lot of hospitalizations because the disease was so severe. With Omicron, we still saw a lot of hospitalizations, even though most people had a mild course. A very small percentage of them got seriously ill, and that number adds up when we have hundreds of thousands of COVID cases. So the emphasis now is on resource utilization and not overwhelming the hospital systems, preventing severe illness and death. As you said, based on those metrics here in Jefferson County, we're still in the red. So there was a shift, and many counties did across the country did shift out of the red kind of spontaneously with that. But we still have a ways to go here. I think in healthcare settings, in special congregate living settings, that it's still a very important tool to be masking. I know I will continue masking, and I'm interested to see what our schools choose to do because they have some kind of special considerations. My child will continue to wear her mask to school. So.
Let's just transition to that question about MISC, which is a complication of COVID many children are experiencing, and which you guys have addressed. I know that Dr. Kristen.
Yeah, Dr. Bryant. Yeah.
Misty talked about it on the press conference last week. This is a very serious complication of COVID for kids, and that's why you guys have really been pushing getting the kids, under 5 vaccinated.
Yeah, we really hope to see the new data about kids under 5 within the next probably 6 weeks or so. I'm expecting it kind of late March, maybe early April, spring break time. And I hope that we'll be able to get those kids vaccinated. Many of the criticisms around the new CDC recommendations have been that they don't provide enough protection for those with immunocompromise or for children under 5. So that is a serious area of concern. And, most children do have a mild case of COVID. Most children do fine with it. But some children do wind up very sick, hospitalized. We've seen MISC, and we have seen pediatric deaths from COVID. Not a ton of them, but if it's your child, that's unthinkable. 1 is too many in my book. So.
I don't expect you to be an expert on geopolitics, but I'm just concerned and thinking about how this Russian invasion of Ukraine is going to impact the numbers of COVID worldwide.
In that area,
because
yeah.
I can imagine that the vaccination rate may be lower in some of the Eastern European countries. Now that there's a huge amount of movement, refugees moving from Ukraine into surrounding countries, Russian troops coming into Ukraine. What is your thought on how that kind of interaction could?
Yeah, refugee camps are a hot spot for infections of all kinds. One of the things the health department has is the regional tuberculosis clinic, and we do see a number of patients that come to us as recent immigrants or as refugees, and they have been in a camp and have experienced respiratory illnesses, including tuberculosis. So absolutely having people in close quarters. You don't know what the vaccination rates are there, and you certainly could have significant COVID spread in a refugee setting. I agree that would be a concern.
Thank you so much for your time.
You're welcome.
I always appreciate your information, and you give it well in a way that most people can really understand it. We hear words that are coming out of a lot of doctors' mouths on television, especially from the networks, that people just don't understand. And thank you for making it simple enough for those of us who don't have MDs or RNs to be able to.
Of course, it's a pleasure.
We appreciate you. All right, guys, we're going to stay live for just a minute. because there's a couple other people I want to talk to, including this lovely lady.
Are you done? I am not talking to you.
Hi, Kathy.
Who else would you like to talk to?
Kathy, I'll talk to anybody that you want me to talk to. You just let me know.
Well,
Pick
Dr.
somebody.
Well, they're all up. Karina.
I'll talk to Karina.
Karina. Have you met Karina?
I think we may have met at one point.
Sarah, we know each other
How do we
for
know each
from everywhere.
From everywhere. I'm
From
proud of it.
everywhere.
Nice to
Yes,
see.
I follow you on
Well,
Facebook.
thank God.
My husband does too.
Thank God for that.
We all do.
I get a lot of my nudes from her.
I know. We do
So
too.
let's see
Look
this
at this.
beautiful award. That's really
Yes.
cool.
Do you mind, Miss Sarah, if we also have the other
Yeah,
two members of the team with
Absolutely.
us?
Have them come on in.
Eva and Doctora Patti.
Yeah.
So Doctora Patti is like our Dr. Fauci in Spanish.
Dr. Fauci in
Yeah,
Spanish.
yes.
I love that.
Yes. No,
I
She's
love
very
that.
humble.
So
She's very humble.
I'm gonna move the mic back and forth between
Please
the
do.
three of you.
Please
How's
do.
that start? Let's start out with introduce yourselves and tell me what your role is today.
Mhm. My name is Karina Varillas, and I am with La Casita Center. And today we are very honored to be recognized for the amazing work that La Casita and our community has been doing, in benefit of the whole immigrant and refugee communities, Latinx community, but also, to provide the appropriate information in a way that is cultural relevant for our communities.
Wonderful. Okay, Dr. Fauci of the Spanish community. Tell me your name.
I'm Patricia Bautista Cervera. I'm a health empowerment coordinator with La Casita Center. What I do is I read and read and read. I'm a physician by training and a public health specialist too, with concentration in preventive medicine and health population. So what I do is I read and read and read and study, and whatever I read and whatever I get my hands into, I digest, analyze, and then put it in a simple language for all the people to understand.
Yes.
Spanish-speaking people needs to learn what's going on, and I just try to be the conduit to it.
That's beautiful to be that conduit. And I was just saying to Dr. Hartledge, there are so many big words that are associated with this pandemic that a lot of people just can't comprehend. So to be able to have that distilled and explained is a great service. How do you feel at this moment Louisville's Hispanic community is doing as far as vaccination progress? Is it something that they have begun to embrace, or is it still a challenge for you to convince folks to get vaccinated?
I think today a representative from Louisville Metro shared with us that the Spanish-speaking populations in Louisville is about 5%. But when you compare that with the number of people that has gotten vaccinated from this community, it's around 6%. So that is a huge, accomplishment. And we still have many people that reject the idea of getting a vaccine, but I'm a Mexican, and in Mexico, it used to be a really good thing to do, embrace vaccination, because we know that vaccines will prevent an infectious disease that can kill you. So many people are embracing the vaccination.
Doctor, what do you say to those people who continue to embrace the misinformation about vaccines? What words of physicians' wisdom do you have to share?
It's okay to have doubts. It's okay to have concerns, but there is plenty of people ready and eager to answer those questions. And what I know for sure is vaccines are safe and they are efficacious. They do prevent, they do work, they prevent the disease that is severe and will help you to even if you encounter the infection, to survive it and to keep on going. And the best thing is that if you are living day by day to get, to survive, if you get the vaccine, your chance of getting infection is less. So your chance of missing a day at work is a lot less.
And your chance of getting in the hospital and dying is less.
For sure. The severity,
sure.
the severity and the hospitalization, and then in consequence death, can be prevented by the use of vaccines.
Thank you so much. I appreciate that. And ma'am, you are?
My name is Eva Sudillo, and I work in the COVID-19 response team with La Casita Center.
Wow.
So far, we have conducted over 12 mobile campaigns in different parts of the community in the city.
Awesome.
We have distributed over 1,700 vaccines through the community as well. and very happy, very proud to be part of a team that is accompanying the community with the resources, overcoming barriers like transportation, language barriers, cultural barriers as well that we get to approach through our outreach and communication strategies.
Amazing.
And that's we have been doing this actually since 2020, with starting with the testing, but also starting with educational campaigns about masking,
Yes.
and also about how to find other resources. And through now in 2021, that's when we launched our mobile campaigns for vaccines. And we decided that the important work for us to do was to go where the community was, making sure that we were overcoming those barriers. And now we're celebrating just last weekend, we have our first in-house clinic vaccine. So we're very excited about those happening now.
Thank you guys so much for all the work you do. I appreciate you. And go ahead, pop back in there in front of the camera so I can just show. Go ahead, get in there. There you go. What a wonderful team. Thank you so much. We appreciate you guys.
Thank you.
The Spanish Dr. Fauci, I'm going to remember that. That's a pretty awesome recommendation.
Absolutely.
Thank you guys. Appreciate you. So right now, you guys, everybody is kind of scattering around and doing their own thing. I'm going to talk to Kathy Turner for a minute here, but I'll be back. We've got a couple of other live streams for you today. One of which is the Real Young Prodigies are performing at Jefferson Mall, and I'm going to hop out there and give them some time on the platform because they deserve it. Antonio Time Taylor, Nairi Clayton Taylor developed the Real Young Prodigies as an amazing movement of young folk in Louisville, and they are just reaching all kinds of heights of success. And they were in Frankfurt to testify about the Crown Act, the statewide Crown Act, which we passed in Louisville last year. So very excited about being able to go out and give them some amplification because they're phenomenal. So we'll be doing that and stopping in a couple of other places, hopefully in between. So thanks for tuning in, you guys, and we'll catch you in a little bit.